My name is Vasyly Rohovyy. I am a hand transplant patient from Innsbruck, Austria, and the founder of the International Patient Organization, the Voice of VCA Patients. Today, our guest is Professor Martin Kumnig, the head of the Center for Advanced Psychology in Plastic and Transplant Surgery at the Medical University of Innsbruck. Professor Kumnig is a leading expert in psychosocial aspects of VCA, the author and co-author of numerous peer-reviewed articles focusing on psychological evaluation, patient outcome, and ethical consideration in this field. He is one of the founders of the Chauvet Workgroup, an international initiative focused on psychosocial aspects and ethical consideration in the VCA. Professor Kumnig is one of the main supporters and motivators behind the creation of our patient initiative and the member of the scientific board of the VCA Patients organization, the Voice of VCA Patients. Good day, Professor Kumnig. Nice to see you.
Hi, Vasyly. Thank you very much for your invitation to join this online interview.
Thank you very much for taking the time to speak with me. Let's start our talk with the question, how did you get involved in psychology as a science, and what led you from there to the world of transplantations, especially to VCA?
Yeah, that's a very long and maybe also a funny story that I have started working at the Medical University in Innsbruck in 2005 after finishing my PhD degrees. And at the beginning, I was informed that I'm now responsible for kidney transplant patients. And a colleague of mine gave me a template for an psychosocial evaluation protocol for kidney transplant patients. This was a template that consists of 2 pages. So I was working in the field with 2 pages where there's been something written about how to evaluate kidney transplant patients and how to follow up them. And from then on, I was at the beginning, on first sight, I was very interested in transplantation medicine in general. And yeah, I tried to develop protocols and manuals considering the pre-transplant evaluation and also the post-transplant follow-up. And working in the field, I also get involved into VCA. Yes.
Professor Kumnig, could you tell us a little bit about the history of psychological involvement in VCA? I think it would be very interesting for our viewers to know if the first VCA patients had any psychological support during the pre- and post-transplant training.
Yeah, looking back in 1999, where the first bilateral hand transplantation was performed in Lyon, the psychosocial evaluation and treatment and follow-up of patients was at its beginning. So there we very little about what psychosocial factors are important, how to evaluate, how to support, and how to treat patients to be first to be considered as candidates for any VCA, and also how to cope with maybe potential post-transplant issues that may occur, so that everybody in the field knows very little about this. But we had some experiences, and there has been some important research in the field of solid organ transplantation, and it's really helpful to transform this knowledge from what we know from solid organ transplantation into the field of VCA. And over the years, also not only the surgical procedures have been improved, the immunological protocols have been improved in the field of VCA and for sure also in the field of solid organ transplantation. Also in the field of psychosocial research, there has been some important developments in the last years. And yeah, we have tried to develop different protocols and treatment. And yeah, so at the beginning, there was very little experience about social issues in VCA. Today, we know much more, but I'm also sure that we still need further research in this field, especially to conduct important research that especially aims for psychosocial issues in VCA. Because when you compare any VCA procedure, particularly talking about hand transplantation, compared to solid organ transplantation, and hand transplantation is what we call is not a life-saving procedure. It is a procedure that should help to improve quality of life of our patients. So therefore, psychosocial issues are very important because we aim for the increasement of quality of life because of this procedure, compared, for example, with an heart transplantation or a lung transplantation.
Yeah. Professor Kumnig, you are an associate professor in clinical psychology at VCA Center at the University Clinic of Innsbruck. And could you tell us a little bit about psychological involvement in the hand transplant program in Innsbruck? How did it all start here?
For sure. As I have already been talking a little bit about the beginning of VCA worldwide, there has been the first bilateral hand transplantation in Lyon, in France. Bilateral hand transplantation has been performed in Austria at our site, at the Medical University of Innsbruck, and there has been not really much research in this field. Yeah. In Innsbruck, we have tried from the first years, also to learn from the experiences at our center, and we came up to this point that we had to recognize it's very important to have standardized protocols in place. And therefore, I have developed a standardized evaluation and follow-up protocol, especially for VCA patients. Has been in 2010. We have developed these protocols. I think, if I'm right, they have been published in 2012 in Transplants International. So to talk a little bit more about this, for example, we have a pre-transplant evaluation protocol in place where we assess candidates that are interested in undergoing any VCA procedure. This is a very comprehensive evaluation protocol, for example, that consists of several clinical interviews. And in addition, we use a set of psychometric instruments to collect a little bit more relevant data about our candidates. But we had to recognize that it's not, it's also important not only to assess the patient itself, it's also important to assess the, for example, family members of so to involve them in our evaluation process. For a short example, when you have a very high motivated patient that is willing to bilateral hand transplantation, and you have a spouse that is not very supportive in this context, and for example, she is saying, when you are willing to undergo this kind of transplantation, I will ask to get divorced because I cannot match you with the dead hands. So in this context, you see that psychosocial issues are very important because for sure the patient maybe would we could help to improve functional, aesthetical outcome and social issues, but we are not willing to support that the patient will get divorced. And in this context, we have not only to think about what patients or candidates are most illegal to undergo this kind of procedures, we also have to think about how could we help patients to become maybe better candidates, to be illegal for this kind of procedure. Yeah, so that was the beginning. We have developed our standardized protocols, and we also have follow-up protocols in place to assess patients during their treatment course after transplantation, with a special focus for sure on psychosocial issues and the aimed improvement in quality of life and autonomy in daily living.
You have already started to talk about patients, so to say, patients you work with. I know you work with VCA patients directly, and I would like to ask you, how does the post-transplant psychological support work when it's come to managing patients' expectations? I mean, sometimes the things after the surgery that once were seeming to patients like huge, unreachable dreams can be taken for granted. And the patient starts looking for appearance disadvantages. The hands are too big or too small. The skin color doesn't match to my body, and so on. You understand what I'm talking about. Are there any psychological techniques helping patients to overcome these challenges? Could you tell us about this too?
For sure. You're absolutely right that these issues or post-transplant problems could cause additional post-transplant problems. For example, to talk about organ integration, for an example. So it's important that after hand transplantation, it's important that the patient is able to deal with the transplanted organ in that way that he or she is able to integrate the transplanted organ into his or her body concept. Yeah. And in this context, for example, there could be organ fantasies that could make it difficult to enable a successful organ integration. And this is one example where a psychological treatment could be helpful, helping patients to overcome this phase and helping them in their organ integration process. But there are so many different psychosocial factors that could have an influence on the outcome of an VCA transplantation. Another important point would be that maybe a depressive reaction after hand transplantation. For example, when you have very high when you are aiming for a very high functional outcome that maybe would not be achieved in the first decades or the first months after hand transplantation, this could make somebody feel depressive or could develop a depressive episode. And this is another aspect that it is important to evaluate, also to follow up our patients during this period and to offer additional supportive psychological treatment if it's needed. What I would highlight, especially when we're talking about the follow-up of VCA transplant patients, I would absolutely highlight how important it is to have a very comprehensive follow-up. That you have the possibility to stay in contact with the patients, to learn from them how they are coping with their transplanted hands, for example, in their daily routines, in their daily life, what is working well, where are problems that need to be addressed, and where we could, as a team, could offer supportive psychological treatment if it's needed and if it's helpful.
So to say, there is a possibility to help patients, yeah, in this difficult situation, and help them to avoid, so to say, post-transplant disappointment with their new organs, and find a possible solution for them in this case.
For
So to
sure.
say, yes.
Sure, there are different options to support and to help patients. Yeah. As I have been talking about, for example, dealing with this organ fantasies, helping patients get the transplanted organ into their body concept, dealing with depressive reactions after transplantation. Yeah. Maybe you also have some struggles in daily routines or regarding daily routines where it's to have a closer look on that. Yeah. So we are talking about neuroplasticity. So psychosocial treatment, psychological treatment is one important part of the whole follow-up treatment protocols that are for example, at our transplant site, but I know that there are many transplant centers worldwide where they are not only dealing with immunological issues, they are also focusing on psychosocial issues and offering specific treatment for their patients.
In your opinion, is any psychologist qualified to work with VCA patients, or is special training required to do this job?
That's a very important question. When you're asking me, I'm working in this field now for almost 20 years.
20 years.
And I have been trying to develop a specific terminus that talks about transplant psychology, because the psychosocial issues that you are confronted in the field of transplantation medicine maybe could be different to other fields of psychology research or treatment and stuff like that. So in my opinion, it would be helpful to have a special education in transplantation to work as a transplant psychologist. And to talk a little bit more about this on an European platform, we are working on this. I'm also a member of the ELPIT group of the ESUT, of the European Society of Organ Transplantation. This is a special group that focuses on psychosocial, legal, and bioethical aspects in transplantation medicine in general. And we are also a group of international transplant psychologists there, thinking about possibilities and opportunities to develop a specific transplant psychological curriculum that could be offered to colleagues who are already maybe working in the field of transplantation medicine or who are willing to work in this field, to offer them a special education, a special training for somebody who is already a psychologist, but who is working in the field of transplantation medicine.
Professor Kumnig, my next question would be, so to say, continuation of my previous question. You are one of the founders of the Chauvet Workgroup. Could you tell us why the group is called Chaveet and what are its goals and objectives?
Yeah, for sure.
Mhm,
I originally, when I'm right, I had in 2011, I gave a presentation at an European psychosomatic meeting that was held in Budapest in Hungary.
mhm,
And there I was talking about this idea to create an international platform of experts that are working in the field of VCA transplantation. And these experts are especially interested in psychosocial issues that are considered in the context of VCA transplantation. Because the problem that we have is that we have no specific or no specific evaluation and follow-up protocols in place
mhm,
that are generally used at the different transplant centers worldwide. So, for example, in Innsbruck, we have our protocols development and with that we are working. But maybe when you're looking to other VCA transplant centers in the States, they maybe could have a different evaluation follow-up protocol in place. So we have no standardized protocols and instruments. And
mhm,
in addition, there is only a small number of patients that had undergone VCA transplantation until now. So
mhm,
we still know not all about psychosocial issues, for example, in VCA transplantation. And that's why I came up with this idea to found an international expert platform and
mhm,
group that especially focus on psychosocial issues in the field.
mhm,
Yeah, I gave a talk about this at this psychosomatic meeting in 2011. And then I was thinking, how should we name this group?
mhm,
Originally, we came up with an idea to call it the Da Vinci Group or something like that.
mhm,
There's a prosthesis in the States that is also called Da Vinci, if I'm right, or
mhm,
Leonardo, I don't know it exactly.
mhm,
We had to find another name. And
mhm,
then I came up with this idea, let's call it Chauvet Group, because in France there are the Chauvet caves, and
mhm,
they show prehistoric handprints.
mhm.
Um,
Interesting. Mhm,
So in these caves, you find handprints from people they have made there. And so I decided, okay, let's call it the Chauvet Group. And so the name was born. And
mhm,
if you have a look at the logo of the Chauvet Group, you also see the handprint there. Yeah.
mhm, mhm. Yeah, very interesting. Thank you. But psychology, how do you think, has already its role in the field of VCA completely recognized, or is there still a lot of work ahead?
I think we have done great work in the past, but
Mm-hmm,
there's still a lot of work that we have to address for the future.
mm-hmm,
Also,
mm-hmm,
as I have told you that I'm in the field already about 20 years,
mm-hmm,
working in the field of VCA transplantation, and I have recognized that there already has been a shift in the VCA transplantation. So there are more and more experts worldwide that have recognized that
mm-hmm,
VCA transplant procedures maybe are not life-saving per se when you're comparing it with heart transplantation, lung transplantation. So we are
mm-hmm,
about procedures that could help to improve quality of life. And when you're talking about quality of life, or let's call it health-related quality of life, psychosocial issues are getting more and more important. So therefore, there has been a shift in the field of VCA transplantation medicine, that more and more people are recognizing that it's important to take care and to consider of psychosocial issues. And the psychosocial aspects are one of the main outcomes of VCA transplantations. Yeah. For example, when you're looking, we already have been talking about the body concept and organ integration, or activities of daily living and yeah, emotional well-being, stuff like that. These are important transplant outcomes in addition to functional outcomes, for example, when we are talking about hand transplantation. So I think we have done already good work until now, but there is still a lot of work that needs to be addressed in the future. Yeah.
Yeah, you are right. Psychology play more important role in selecting candidates for VCA. And I would like to ask you one more questions. Let us suppose there is a person who really wants to have a new hand or a new face, but you, as a psychologist, see that the patient isn't ready for the surgery, or it would be a right decision for him or her to undergo VCA. In this case, you have to say no. As I said, it's a really big responsibility to take decisions that may affect someone's whole life. How do you personally deal with that as
That's
a human being?
Yeah, that's a very important question. And as you have already said, it's a very important decision that has an impact on the candidate's whole life, or could have an impact. Yeah. So therefore, from the beginning, from considering my work in the field of VCA transplantation, I have tried to differentiate between absolute and temporary contraindication. So in my opinion, it's very difficult to identify and to talk about absolute contraindications. For sure, there are some one. For example, if you have a patient that suffers from chronic suicidality, a patient that has tried different suicide attempts, high depressive scores, yeah, it's in a very high chronicity of his or her symptoms, and a very psychiatric history. Maybe this could be an absolute contraindication at the point of evaluation. But in my opinion, it's much more important is to talk about temporary contraindications. For example, you have a candidate that is considering a VCA procedure. But maybe at the point of the evaluation, there are some psychosocial issues that need to be addressed. Yeah. So, for example, the candidate describes some above average depressive symptoms. Yeah. Maybe we came up to the decision to say, okay, this is a temporary contraindication just right now, and we have to start thinking, how could we improve the eligibility of the candidate to undergo the requested a procedure. So what could be helpful? And in this context, for sure, there are different psychological treatment options that we could aim for to deal with the depressive symptoms, and best case that the candidate, after re-evaluation, describes no depressive symptoms anymore, has improved in his quality of life, the other different aspects that are important in our life. And maybe when we are doing this, maybe this could be also an option, that the candidate came up and says, okay, now I'm so sad with my life. Also, I have no hands, or also I'm missing of one hand. so that I'm not still aiming for VCA procedure.
Yes, I understand.
Could also be an option that maybe there have been some psychological issues that the candidate is trying to solve with undergoing a VCA procedure, but it's it could be much more sufficient to deal with these psychological issues first and then re-evaluate the candidate again and have a closer look if he or she is still wanting the VCA procedure. And if this is the case, we can re-evaluate, for example, the depressive symptoms we have been talking about as an example. Has he or she improved in this context? And is he or she now eligible to go this kind of transplant procedure? Yeah. So in this context, it's very important to differentiate between temporary and absolute contraindications and what a transplant center could offer to candidates to become maybe potential better candidates for VCA procedures.
Professor Kumnig, you work with patients and for patients. Do you believe is it important for VCA patients to communicate with each other before and after the surgery? Does it have any positive psychological impact on them, in your opinion?
This is a very interesting and comprehensive field you are now talking about. So we are talking about peer education. We have different research projects addressing this important topic just right now. In my opinion, peer education in transplantation medicine in general is very important. And you can, for example, you can have a peer education or peer mentoring program for kidney transplant patients when it's important, for example, to support them in their pre-transplant phase, but also for sure in their post-transplant phase, for example, when they have to deal with different issues in their daily routines, how to deal with immunological issues or side effects, how a healthy lifestyle should look like, how could I deal with depressive symptoms, with other problems, emotional that occur and stuff like that. You see, there is a lot of work to address. And the problem is that the physicians or the transplant health professionals have limited time to talk with patients, to deal with these issues. And in this context, a peer, this is a patient that already has undergone the same procedure and now is healthy and stable, could give additional supportive and helpful informations on these topics. So in my opinion, it's very important to enable the communication and interaction between patients. So this is a reason, that's one of the reasons why I have decided to support your initiative at the very beginning. Yeah. Because it's an important topic that we have to address and we have to look at. But it's also important to train peers, also to train patients that are willing to work as a peer, because this could have, in the best case, an positive effect. But it also could maybe cause negative reactions or could have a negative effect. So, to give you an example, if you have a hand transplant patient that he has a very strong opinion that the hand transplantation is the best option you have.
Yes.
You always will be a winner and everything would be perfect and you would have high functional outcome. Everything is wonderful. So maybe this could not be the reality. Yeah, so and this could influence another candidate or patient, how he or she is looking at his or her options. And this could have also negative effects. So in my opinion, peer mentoring is very important. The communication and interaction between patients is very important. But as a transplant center, you should also start thinking about how to train, how to inform, how to educate these peers that they have the skills, the information to work as a peer and to educate others in a sufficient and especially important in a realistic way.
You're right, absolutely right. Yeah.
So therefore, I highly support your initiative.
Thank you.
Communication is very important in this field because we have so less patients still over the world. And therefore, in my opinion, it's very important to talk with each other, to connect with each other, and yeah, what could we learn from each other? So this is the same idea. From that idea, we have developed the concept of the Chauvet group. Because we are a small group of experts in this field. You, as patients, are also a small group.
Yes. Yeah.
Yeah. So you have to interact and connect with each other to learn from each other. Yeah. But it's
I agree.
how this be realized in a very good, structured and trained way.
Yeah. Yeah, Professor Kumnig, thank you very much for this interesting and educational talk and for supporting our initiative in this way. I was very glad to see you again, and I hope to see you in the future more often. Have a nice day and see you.
Yeah, you're welcome. And I congratulate you to your initiative and the initial work that has been done.
Yeah.
Thank you for the possibility to talk a little bit about my experience in the field of transplantation medicine, especially focusing on psychosocial issues. And thank you for your invitation. And yeah, I wish you and all the other patients the best for you and their future.